So every 10 years, the National Assessment of Adult Literacy, that's the organization, does a study of the nation's literacy, quite a large study. And in 2003, this decade, they specifically looked at health literacy. And health literacy is defined as the degree to which people have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. Well, I'll tell you that the Health Literacy Survey studied that 35% of adult US population has what's known as low health literacy. That means they are not able to very adequately assess the information that they need to make good decisions. So it's estimated that this low health literacy costs the country around $106 billion to $238 billion every year. And how is this possible, you ask? How can low health literacy affect the country so badly? Here are some basic things that you don't think about when you think about health literacy. Filling out forms in your doctor's office. When you're filling out those forms, do they remember to list every single drug they're taking, including supplements, including over-the-counter medication? People on low-salt diets, you might not think about it, but not everybody knows that salt and sodium are the same thing. So when you're looking at packages and they say sodium, they don't say salt on them. They may not know what they're looking for. What is the difference between a TSP, when you're reading the medication, you're reading the bottle, a TSP and a TBSP? Oops, I'm sorry, I am not making this up. In the last month, I've met 2 people in my classes, 2 librarians, who did not know the difference between a TSP and a TBSP. That's because they don't cook. If you don't cook, you're not in common, teaspoon, tablespoon. But if you're giving medication to children, you really need to know the difference between a teaspoon and a tablespoon. Also, people don't read the stickers that they put on medication that they get at the pharmacy. So if it says do not drive, they drive anyway. Overdoses of acetaminophen account for over 56,000 emergency room visits a year. Acetaminophen, which is Tylenol, used to be, we think of it as the safest of the pain medications, but in fact it's very easy to overdose on it if you don't realize that they're putting acetaminophen in other medications, like in the medication that you take when if you're having trouble sleeping, or a lot of times late night cold medicine, or hydrocodone, which is Vicodin, also has Tylenol in it. So you need to really know what's in your medications, and not everybody looks at the detailed list of what's in their medications, so they accidentally take twice as much as they should, and they end up in the emergency room. So it's a very big issue, and public libraries have a really important role in that issue. And here's why. Tons of information is provided that you do not need to read. You can listen to videos, you can watch health tutorials, and I'm just going to show you here for a second. We've got some health videos you can find online for free from Medline Plus. I always have to plug Medline Plus, which is the National Library of Medicine's consumer health website. They have health videos, they have tutorials, health tutorials, that's those 2 things. But you can also get health videos through the TextShare databases. And you can buy them. There are lots of places you can go online to buy online videos. So these are great things you can get on the internet without having to just check them out in the physical video category anymore. There's also personal health records. I don't know if everybody's heard of that. You can, let me get all of these guys up. You can chat with your physician. There are a lot of physicians who answer email or even who do chat. These are let's see what else we can do. We can do webinars. I did a webinar yesterday, in case anybody here on my webinar yesterday? It was on boomers, baby boomers, and the health information issues that are about to hit your libraries in the next couple of years when the boomers get to be 65. And communicating, there's Medicare forms. Everybody has to fill out their Medicare forms online. What do you think? Do you know when baby boomers are going to be filling out their Medicare forms? Next year. So they'll be doing that online, and they might be coming to your library asking for a little bit of help. Also, you might have support groups on forums, educational games for everybody to play, and there's interactive health check tools online. So those are a whole bunch of things to think about. Obviously, public library is a great place to find information. Public libraries can do a ton of things They can lead people to authoritative websites. They can help people learn how to evaluate websites so they know the difference between a good one and a bad one. They can let people listen to videos and tutorials by giving them headsets in the library so they aren't making all that noise. They can help people find information at a reading level that's appropriate for them. They can have programs at their library, which is one of my things that I try to encourage people to do, health information programs at the library. And you can even take a broadband computer on the road. Take your computer and a projector and go out there, if you have a broadband computer, if you get this, go out there and do your programs at senior centers, at community centers, at all different places. You can do it at high schools. So the last thing I wanted to point out is that the National Library of Medicine has created an organization, that's us, the National Network of Libraries of Medicine, to assist its members, which all public libraries are welcome to become members, but basically to make sure that people get the information they need. So for example, if a doctor came into your library, and in rural situations this might happen, if a doctor came into your library and really needed a journal article and asked you to interlibrary loan it, well, a lot of times it takes a public library a couple of weeks to get an article, whereas a doctor might need it that day or the next day, and a person's health depends on it. Well, you could contact us, and we would put you in contact with a nearby hospital or medical library who would be happy to get you or the doctor that information. Also, we provide some funding for internet access. We've provided funding for projects like, I was going to mention San Antonio Public Library got some funding last year to do a lot of work with community health workers and training with community health workers, and also did an incredible tutorial on the web, Medline Plus, in Spanish, a Spanish language tutorial for Medline Plus on the web. So we also have free classes. So if you want more information on our resources, I put some flyers out at the registration table if you're interested in funding or class information. Thank you very much.